As in previous years, this year too, the Armenian American Health Professionals Organization, AAHPO, members and their families have gathered at a delightful Christmas brunch at the elegant Waterside Restaurant in New Jersey. The event began with AAHPO's member, Dr. Arthur Babayan, who read the organization's mission statement.
AAHPO's mission is to improve health care awareness, increase disease prevention and early detection, foster fellowship and career development of Armenian health care professionals, and provide medical support and education to both our local communities and Armenia.
President of AAHPO, Dr. Lawrence Najarian, opened the event with welcoming remarks and recognizing the presence of two of AAHPO's original founders, Haik Kocharian and Karine Kocharyan, among others. In his speech, Dr. Najarian also touched on AAHPO's history and asked for current and former board members to stand up and be acknowledged.
We started with a few programs. They were like little different silos all unto themselves. And over the last 15 years, 12 years, the programs have grown individually and developed tentacles in between, and there are now synergies in between, as we'll hear more in a few minutes. This major accomplishment is really an incredible feat. We're all here, we all are part of this organization because we want to help others. But never, never underestimate what we can all do by collecting our energies and working together. What we have accomplished this year is we have trained over 50% of the physicians in Karabakh. That's incredible. 50% of the nations in a country. Great job, everybody.
Touching on the subject of 2015 AAHPO medical mission in Armenia, anesthesiologist Dr. Vahe Tatiosyan, obstetrician gynecologist Dr. Lucy Tovmasyan, and DMD Joyce Kurdian spoke about their experiences and impact their work has had on the Armenian population and called for other AAHPO's members to join the next mission.
Missions that we go to Armenia and we actually perform surgery. Either it's something that they're unable to do or don't have the ability to do there, or more so the collaboration with the physicians there and the physicians here. What we try and do is not only go there and do surgery, our idea is to go there and teach them our techniques, teach them our methods, and actually continue. So it's very easy to just go somewhere and do 50 surgeries. Any of us can do that. I can go next week. There are people there that are willing to do that. We can go do 50 surgeries. The difficult part is actually having them learn our techniques, learn from us, and we learn from them. The idea is we don't just want to go there and provide care for a certain finite time. We want to go there and create an actual network and be able to have them come to us anytime they want. They have a difficult case, they phone us. Communication is so easy these days with any kind of modes of communication.
With the medical mission group this year, we went to the town of Armavir, which isn't very far outside the city of Yerevan. But all of a sudden you're in this rural area and they don't have access to a lot of the things that we take for granted here. So through working with COAF, we went to some of the little hospitals or villages that they have formed. They've taken old hospitals and or clinics, little clinics, and revamped them. You get to go and work, you get to meet the other physicians and doctors and dentists, things that are taken care of here for granted. Like you see children who have all their teeth pulled because they have cavities on every little tooth as a baby, as a child. Things that fluoride addresses here, sealants address here, we don't even think about. These rural communities are really fighting with day to day. So there's a lot of little things that we can do just by going and volunteering and helping.
I hope that we can express to you or have you understand how passionate we are about this and how each of us have committed to going back this year, and we hope that we can instill in you guys a similar passion and want to come with us. Whatever capacity that you can help us out in medical, non-medical, we need people across the board. So if you guys, anyone is interested in participating in this year's mission, which will be in July, I think we're June or late June, early July. Please see us and give us your name, email address, and we'll forward you information.
Dr. Lawrence Najarian with Dr. Arthur Kubikian hands its certificates of recognition to all participants of Mission in Armenia 2015. Dr. Kevork Yakjan spoke about telemedicine, a program founded with Armenia Fund USA 10 years ago, and how it benefits medical professionals in Armenia.
Hybrid program which we developed, it's a software, it's a technology, and it's some kind of infrastructure which we built during these 10 years. What was our accomplishment in 2015? We have more than 28 telelectures during this year. It means every 2 weeks during 1 month we have lectures. We have a simultaneous connection with the 4 to 6 sites. And its site was a border village in Tavush, its villages in Rapan, it's Rapan Regional Hospital, it's Stepanakert, and many other hospitals in Karabakh. We have a special website on the medical library, a website where we can put the actual lecture, the slides after the televising this, so the doctors can read. And also we prepared a special SurveyMonkey feedback so we can understand what was interesting for them. And each year we're starting with sending the feedback, getting a feedback from them, which the lecture will be important in 2015.
For his service to AAHPO, Dr. Viken Pamukyan was honored with an award presented by Dr. Lawrence Najarian. Of course, no Christmas party would be complete without a presence of Santa Claus, and his arrival delighted both children and adults. This joyful holiday season event also had an important and serious component to it, allowing the AAHPO members to wrap up the past year's achievements and chart the plan for the upcoming year. This gathering also served as an opportunity to recognize the hard work of the organization's members from 20 years past to the present day.